what is this, what is the, in this relationship, who is this. That's why anatomy is very, very important. Okay. Positions of the uterus. There are 4 positions. Four different positions. One is anteverted. Okay, look at the spelling, A-N-T-E, not anti. Okay, and that is 50%. Number 2, anti-flexed. 20%. Retroverted. 20%. And retroflexed. 10%. Most of the times you will see the antiverted. Okay, the problem happens, they might have problem with the concept, that is retroflexed. Retro means facing towards the rectum. The uterus fundus is facing towards the rectum, that is called retro. Retro means behind, back. And anteverted means facing towards the bladder. Okay, so now look at here. I am a straight, upright position. The bladder is in front of me and the rectum is behind me. And I am making a curve, flexion. And I am such a way I am curved. In this position, you will see that if you draw a line from the cervix or through the body of the uterus and draw a line through the vagina, it makes 90-degree angle. I will draw it for you. So this is nice curved like a C, anteverted. But if my body and the fundus is flexed from the isthmus at 90-degree, that is anti-flexed. Same thing, if my body and fundus is going towards the rectum, that is retroverted, and if it is folded at the isthmus, the body and fundus at 90-degree, that is retroflexed. Okay, so now I will draw the diagram to make it easy for you. Let me give the concept again. So this is bladder. So this is uterus. I am drawing it straight first. Okay, this is uterus straight. This is bladder, this is uterus. And this is rectum. Rectum. So now this is front and this is back. This is isthmus. This is fundus and this is body, this is cervix. This is vagina. Okay, so this is rectum. If this uterus is folded, I'm drawing a line like this, known as anteversion. Anteversion. And if this uterus is folded towards the rectum, that is called retroversion. So this is the basic concept. Basic concept. Okay? And another things I'm going to show you. Okay, I need a little space. Look at here. This is isthmus. This is body and this is fundus. And this is cervix. And this is vagina. You probably notice that uterus is nicely carved. And it makes a unique curve through the isthmus. So cervix, body, fundus is a nice C-shaped. And if you draw the line through the cervix, and if you draw the line through the vagina, look at here, it cuts a 90-degree angle. If you see sonographically, this is 90 degree, so this is anteverted. This is anteverted. So, what is the anteverted? The line drawn through the cervix onto the body fundus, and a line drawn through the long axis of the vagina. It cuts at 90 degree. That is known as anteverted. Known as anteverted. So sonographically you will see this picture. You will see this image. The bladder is here. This is bladder. Okay, and you will see the rectum is here. This is rectum. Okay, automatically you can say this is anteverted. To get the anteverted, make sure the bladder is full. Bladder is full, so that it can push the uterus more down. Otherwise uterus will be more onto the bladder. That is look like anti-flex. Okay, so now I will draw the anti-flex. In anti-flex, look at here, this is isthmus. This is isthmus. This is cervix. Okay, you can make it little healthy. And this is body and fundus. This is fundus and this is body. And this is endometrium. This is endo. Okay, and what is the bladder? So bladder is here. This is bladder. And this is uterus, anti-flex. This is the one second. Yeah. Oh, sorry, I make a little mistake. It has to be towards the uterus. I'm drawing little retro, but this is no good. Sorry for that. Okay, so now you will see this is fundus, this is body, this is isthmus, this is cervix, cervical canal, cervix, and the bladder is here. You see there is a big indentation of the bladder. There's a big indentation of the bladder. Why? Because the body and fundus is flexed. At the isthmus, at 90 degree. Okay? So body, if you draw this diagram and if you draw the body and fundus diagram, then you will see at the isthmus, there it will be so this way and this way. Okay, so this corresponds with the body and fundus. Then you will see this junction is 90 degree. So here the angle is 90 degree at the isthmus between the cervix and the body and fundus. Okay, so now in this situation we call it anti-flexed. Anti-flexed. So now let me draw another diagram for you to understand the better anti-flexed. Sonographically, you can see okay, this is isthmus. Okay, so the bladder is indented. Let me show you the bladder. So this is bladder. So bladder is compressed anteriorly, and this patient cannot hold this person cannot hold the bladder long time because it is compressed by the uterus, and patient feel like I need to go to the bathroom. So this is okay, if I draw it here, so this is anti-flexed. Okay, in anti-flexed, if you draw a line through, and then if you draw a line through the body and fundus, then you will see it cuts 90 degrees. So this is anti-flexed. So now I will show you, okay, this anti-flatter, anti-flex, the pregnancy is no problem, okay. I will show you the retro. In retro, the uterus so this is bladder, this is uterus, and this is rectum. Okay, so now look at here. The uterus is pushing the rectum, and the bladder is free, and the bladder is getting distended more. Okay, bladder is getting distended more. So this is retroverted. And sonographically, how does it look like? Sonographically, you will see okay, sonographically you will see the uterus is turning, so this is bladder, this is uterus, and this is rectum. Uterus is turning or curving, making a C towards the rectum. Okay, making a C towards the rectum. If I will draw another one. So just get the idea that uterus is going towards the posterior, the fundus and body, And when it's really bladder is full, good full, then you will see the uterus and the fundus, vagina, so this is vagina and this is uterus. If you draw a line through the uterus, through the cervix, and you draw a line through the vagina, and it cuts 180 degree, and the bladder is here. This is bladder. I hope you understood. And the rectum is here. When you see this, then this is retroverted. But it can happen false retroverted. How? When the bladder is super duper full, it totally compress the uterus posteriorly, make it flat, and it looks like retroverted. Okay? So then you have to check with the normal filling in of the bladder, not super duper. Okay? So this is retroverted. So now I will draw the retroflex. The think about at the isthmus, the uterus, the fundus and body is turning backwards. Okay? So I will draw the retroflexed. Okay, so this is retroverted. It's a good looking. Okay, so now retroflexed. In retroflexed, let me draw the anatomy first. Sorry. So this is rectum. Okay, so see, the uterus, body and fundus is folded at the isthmus at 90 degree and is getting rest on the rectum, and the bladder is here. Bladder is here. Okay, so this is bladder, this is uterus, and this is rectum. So this is retroflexed. And if you draw a line, and you draw the line through the body and fundus, it will cut at 90 degree. Okay, so now sonographically, how does it look like? Let me draw the sonographic view of the retroflexed. Okay, know the orientation. This is anterior, this is posterior, this is superior, this is inferior. Okay, and this is a SAS view, sagittal view. You will see the bladder here. Then you will see this is cervix, this is isthmus is here, and the body and fundus, okay, and who is here? Rectum. Look at here, in retroflex, the rectum is compressed by the, let me show you the compression. See, it is, rectum is compressed by the fundus of the uterus because it is turning back towards the rectum. It can cause the constipation, obstruction, and even though it is difficult to have a fertilized egg or conceive can be difficult, but still 10% is present and they conceive nicely. Okay, so just take care about during the first trimester. It should not be any problem if somebody is conceived. But to get the sperm and to come back the fertilized egg, that is the blastocyst, into the uterine cavity can be difficult. That's why miscarriage is common. Difficulty in getting concept is more in retroflexed. Okay, I hope you understood the 4 positions with the clinical condition and the sonographic appearance. I hope